For the last couple of years, many people are very familiar that home births have become more popular. But have you heard about a free birth? In fact, free birth now is the new trending birth. Should it be the new trend? Is it more dangerous? And really, is it an option for some women in the United States? And how may it impact our maternal health outcomes? So, is free birth truly free from complications? Or is it the long awaited maternal health clapback many birthing individuals have been waiting for? We answer this and so many other questions on today's panel discussion. You guys are not going to want to miss this, okay? We thank you guys for watching, and don't forget to do what? Click subscribe. So excited to have back with us Theresa Lasbrey-Peters. As you guys know, she's the CEO of Nnenna Birth. She's a birth and postpartum doula, as well as a certified lactation counselor. Theresa, we're so glad to have you back with us to talk about this very important topic. And for the first time, we're so excited. We have Latrice Matthews back with us today. Actually, for the first time today. See, I'm already prophesying she's going to be back with us.
I receive that. I receive it.
She is also a birth worker. So we have the East Coast, we have the West Coast represented, and Latrice owns her own doula services known as New Baby Doula Services.
Yes.
So make sure you look her up also if you're on the West Coast. So ladies, I'm so glad to have you guys on this platform this evening because this is a topic I feel we really need to talk about. I myself a little shocked that people are really starting to investigate and explore free birthing as an option. And I'm shocked only because of the concern for maternal mortality. And it seemed like the best solution appeared to be the birthing centers and the home births. So let's start off with the fact that most people don't even know what free birth is. What exactly is free birth? Like, school me, because I'm trying to keep up with what y'all are doing.
Free birth is just basically having your baby without a medical professional, without a midwife, without an OB. It often is not attended by a doula because a doula is not a medical professional. Some people, some doulas may do that. That is, that is their choice. Latrice, what's your definition?
The same. Just no medical person there, professional, no midwife. However, I do attend free births if someone wants me there. But with that comes a lot of education, a lot of coaching, a lot of visits, a lot of conversation to make sure we're clear and we're on the same page. Because I would never want to take that space away from a mom who has her own plans, right? So, and which is why people are opting for that free birth. Because when you go into a hospital, your choices are really your options of what your doctor is giving you. It's their choices that you have to choose from. So, with having a free birth, I mean, I've never thought about the definition, but I guess really it's a woman who feels really empowered and understands her body and is going in with the all knowing that, hey, I got this. I can handle this. So, and a lot of times most moms will educate themselves as well.
Mm. So are they coming to you already knowing about free births and already having a plan? Are they coming to you exploring all of their options and free birth comes up as a part of that discussion?
For me, I can say all of the above.
I do not attend free births. And if somebody's comes to me about a free birth, I run the other way in love.
Why is that? Why?
Because there's a certain level of liability. And I completely understand why somebody would free birth. I had a doula colleague free birth one of her births. She'd had previous hospital births, a VBAC, a breech VBAC, and that the midwife missed. So she had a free birth without her intending, and then just decided that she was going to have the baby and probably had the most peaceful time. Shoot, I wish you would interview her, right? Like, because you would know her motives, and the birth was successful, but I am just the level of liability
Mhm.
and the concern about complication.
Can
Um,
can the can the individual take on all those liabilities? Like, is that an option for them to sign a contract that says, I'm aware that I'm putting all the risk in my hands. I'm taking full responsibility for every and anything.
my insurance, barely covers home birth, and home birth I absolutely love. And a free birth is just something that somebody has to really have knowing, knowledge, and skill. And, your birth is yours, you are free to make your choices. I just, I don't want to be part of a free birth, not because I don't respect your choice. I just don't have the knowledge or expertise. And I only want to be in spaces where I can help, that where I can, if something goes left, that I can help. But most birth is uneventful.
Mm-hmm.
Most births are uneventful. And most of the events that happen in birth that I've seen are caused by, nitpicking and intervention and stress caused by that.
So when someone says to me that this is what they want to do, that's where those visits come in. I make it a point to make sure I'm visiting with this person. I'm talking to her constantly, and I really want to hear her level of confidence and how she feels about her body. And yes, what was her intention? Like, why are we going this route opposed to, going to a birthing center or having a midwife? And, is it just financial because, for not having a midwife? Like, what are all the reasons behind here? So let's have this conversation. Let's have this open dialogue. Let me see where you are. And again, as a doula, I have the choice, even though I may be called, sought out, I still have the choice of saying, you know what? I don't know. I don't think that this is really outside of my scope for whatever reason, especially like if it's a VBAC, especially if I know that with previous births, something happened, the baby heart rate dropped, mom's heart rate dropped, like different complications like that. I look at all of that. And so Teresa's right. There is a certain amount of liability that's there. And so that's another conversation that I will have with the family in saying, listen, so are we clear? I am not a doctor. I am not a midwife. Yes, I have knowledge and I have a lot of experience. However, I'm not coming in here with any equipment. I don't have anything. I'm not passing myself off as anything that I'm not. So I'm here to support you in what it is that you want to do. So again, it's really about those conversations. I'll give you an example of one of the moms that I worked with. Her first daughter, the first time she was pregnant, she went to her doctor. Everything was going well. She was ready to have the baby in the hospital, right? And she went on YouTube and she's doing her research. And so she asked her doctor, hey, what about Lotus birth? And what about, birthing the baby in a pool? Do you guys do that? Like she was just asking. And he told her she was stupid for asking that question. He told her she was, yes. And so from that, she said, oh no, you are not touching my baby. I'm having my baby at home. My grandmother delivered my mom. I already know. And, so that level of intuition, I guess, really kicked in for her very hard and very strong. And she was like, this is what I'm doing. And she did with her daughter. I wasn't there for that one. But she had her mom, she had her grandmother, and she had the baby's father. They delivered her baby. And the way I met her was actually at a conference. She found out that a doula was there, which was me, and she sought me out. And she was like, I just have to tell you my birth story. And she did. And we connected. And I was like, and I told her, the next baby, I'm going to be there. Lo and behold, COVID hit. She was pregnant, and I said, I will drive to you. I'm not going to get on a plane. I'm not going to risk anyone getting sick. But I had a wonderful cross country trip from California to South Carolina. It was awesome. And she did great. And we did it again. Dad was there. She had a water birth. Grandmother was there. Well, her mother was there. Her grandmother couldn't come because she was sick. But yeah, and that's what she did. And she already, like, the confidence was already there. Like, and she trusted her body.
I'm just impressed with the fact that you drove across the country during COVID.
It was absolutely wonderful. Can you imagine the traffic?
I know it must have been beautiful.
How long
Beautiful.
did it
But
take?
that is serious dedication. Help
Yeah.
me to understand the patient or the client, the woman, the individual that is considering free birthing. And you mentioned a term also. You said Lotus birth. Can you clarify Lotus birth, free birth? Are we talking the same thing?
We are talking the same thing. A lotus birth is when you have, after birth, you do not cut the umbilical cord. You allow it to fall off naturally, which happens usually somewhere between 4 and 7 days.
Okay, that's what I wanted to get at. So thank you for clarifying that because that's also trending. That's also becoming more common. And perhaps we'll talk about the science behind that in a little bit as well. But help me to understand the woman that is seeking a free birth, is she also attending medical visits during her getting actual prenatal care? Is she limiting her prenatal care? Like, what is her usual flow when it comes to the actual management of her pregnancy?
I've actually seen both. So if someone has like a medical person that they've been working with that they know they're really, really comfortable with, they're able to convey to their doctor, hey, this is what I have planned, and there's no pushback, they will continue to go see the doctor. The only time when I've seen people say, I'm not going to go see him anymore, is because of however they felt, whatever that feeling is. So again, that's systemic racism. It's heavy, it's real, it's strong. It causes anxiety, it causes all kind of things in a woman's body. And when she's pregnant, that's when her intuition is the highest, right? So if she is feeling like, I'm not going back, she's not going back. A lot of times, what I will do, because I do know midwives and I know student midwives, I will say, go and at least see someone. Go see her. Let's make sure that your heart rate is fine. Let's go ahead and check whatever we need to do. Let's listen to the baby's heart rate. Um, and so I can get it in that way if I need to. If I go with my gut feeling, a lot of times I do, and I will say, you know what, let's just see what this is about. Which is why, again, it's a lot of conversation, it's a lot of visits, even if it's through text. Let me see how you're doing, what is going on. Because another one of the conversations, one of the first conversations that I do have is if I say, hey, we need to go to the hospital. Something is not right. There's no arguing. That's when, from that point, whatever you decide to do, I'm out of it because I'm letting you know that something is not right. However, and that's really, it's only happened a couple of times. Um, and it all ended up working out just fine, thankfully. Um, but that is like a real, serious conversation that I want the family to know and understand that when it's time to make that call, we're making that call. We have to.
Gotcha. That's interesting to hear though. And I do want to touch on how do you plan for the potential of complications and how do you guys address that conversation? But before we go there, Theresa, we have gone through this phase of looking at maternal health. We have gone through the shock of the poor statistics in the United States. And then it seemed like there was this push towards midwifery care and to increasing the availability for midwives, especially to women of color, specifically Black women. Why do you think we are now trending away from that? It feels like we didn't sit in this trend of midwifery care for long before the free birth started to take off. So what happened that we're starting to see a trend away already from midwifery care, or are we seeing a trend? What are your observations regarding that?
I don't think that there's a shift away from midwifery care. I don't think we've explored it enough, and I don't think that there's a shift past home birth. I think that different things are trendy, and some things are evidence-based, and some things are not, right? Like, um, I think free birthing is something that people probably have done for a very long time. And Latrice mentioned the client who was not spoken to respectfully.
Mm-hmm.
Other people, most people would just continue with that OB and just deal with it. Other people might have the onus to go to another clinician or switch to midwifery care or something like that. And this person chose, because she had access and the knowledge, to just, listen to that mother wit and go and do what her mother did, what her grandmother did. And, I wouldn't necessarily do that, right? Not because birth is dangerous. It's not particularly dangerous. Most birth is straightforward. So, people have successfully done births without a clinician or a midwife or a medical professional. And the thing is that it's being shared on social media, right? YouTube, and people are sharing their births. And so there's a different constellation, a certain set of criteria that would make you a good candidate for a home birth, let
Mm-hmm.
alone a free birth. But, like, I would use basic home birth criteria, things that would risk you out of working with a midwife at home. I think might be things that might risk you out of having a baby on your own at home, right? So whatever those things are, just, I mean, there's a whole world of people giving birth on their own, people
Mm-hmm.
giving birth with assistance, like after several C-sections. There's a whole world of it. I think the main thing is that, are you willing to be accountable for the outcome?
Mm-hmm.
Right? Are you the type of person that is not going to blame other people for your choices? And I think that that relationship can be fraught as your doula in the space where you're not a medical professional, you've conveyed that you're not a medical professional, but people don't listen, right? Um,
Mm-hmm.
I could teach people about breastfeeding before they have the baby and advise them after the baby is born. And still things have to be repeated and put back into place because there's so much going on. Right. And I've had people who are like, yeah, something, 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 like, I'm a midwife. And I'm like, I am not a midwife. Maybe one day when I grow up, I could be a midwife, and that'll be great. To do, but I just think that you just have to be very mindful, right? And having a fear-based approach, it's not going to help you, right? So people who are choosing a free birth should do so, um, I guess, from a space of, is this an opportunity for you? Is it an opportunity for you to do something different? Can you do it safely? Birth can be safe. Birth
Mm-hmm.
in hospitals are really difficult,
Mm-hmm. Mm-hmm.
They are difficult. There's all this monitoring. There are the lights. There are all the things that mess around with your parasympathetic nervous system, right?
Mm-hmm.
All the things that interrupt this natural process that can happen, where no one, there's very little inclination to wait for your body to do what it does, right? Which is, you just, it ejects that baby, right? You wait until you feel it. There's no constant checking, constant, putting somebody on a clock. And I like home births for that. But home births tend to be longer, right? They tend to last, home birth can last 5 days for a doula, right? Because you're there at the beginning of it and just holding space and providing comfort until the person is really in the thick of it. And then the midwife comes, so hopefully an hour or so before it's time to push. Um, I think a free birth is just, something that's it's somebody's option, if they're informed. Your child, your
Yeah.
choice. That is my favorite thing to say.
It's interesting because sometimes one of the things that comes up is I want to be like our ancestors. I want to have the experience our ancestors have had. In addition to the group of women that just don't want any intervention, they want the ownership and the complete control of their body and of their process. But even ancestrally, there were traditional midwives. And so I think that's why it's startling in some sense to me because it goes a step beyond what our ancestors actually did. Our ancestors didn't truly free birth. They just didn't have formally trained midwives, but those traditional midwives, listen, the ones I met in Kenya, they're not playing.
Yeah.
They're very knowledgeable about birth and very knowledgeable about how to care for a woman during birth, both from the medical aspect informally, but very well informed, and then also from the ceremonial aspect of it also. So one of the things we've paid lots of attention, we know that for the lower risk individual, home births have not been explored very well or sufficiently for the higher risk individual or the at-risk individual, those with multiple those with multiple medical conditions that have, especially those that require high monitoring during the birthing process. Now, for the low risk individual, we know that the outcomes have been great, right? We know that patients are more likely to have a satisfying experience, less likely to have interventions with the home birth. One of the things that we have, so we've talked about the great outcomes for maternal care. We haven't really spent as much time talking about what's going on with the neonatal outcomes. And that has been a concern because the studies are showing that there is a higher risk for adverse neonatal outcomes. And so the question is, when you are preparing someone for whether it's a home birth or whether it's a free birth, is the neonatal outcome part of that conversation?
Definitely. I mean, and also when speaking to a midwife, right? The midwives that are doing home births, they're coming in with their equipment and they know, trained with neonatal resuscitation, and they usually have their assistant, because somebody needs to tend to the person who gave birth and somebody needs to tend to the baby. And as a doula, I may pitch in wherever I'm told to be. Um, so I just, the data is interesting, right? I would say that the data is conflicting because, most of the births are uneventful. There's so much stuff actually that you said. I want to actually go back to one thing that you said, which was
Mhm.
it was a maternal morbidity, maternal crisis, and people then turned to midwives. They actually started to turn to, like looking to doulas to save the day, right? And but if you have doulas, but you have the same behaviors, it doesn't make a difference, right? If you have a midwife and you have the same behaviors, it doesn't make a difference. There's got to be something around informed choice, um people who are willing to do the research, or surrounding yourself with people, like having a well-informed midwife, a doula that provides you with resources so that you can make informed decisions, you can make these informed choices, and then making these choices outside of just emotion, right? Outside of just avoidance, right?
Mhm.
If you don't
Mhm.
like your OB, change your OB. Have the baby at a birthing center. Do what I always say, which is you don't even, like even Latrice, you were just talking about how people will do their prenatals and they have a whole conversation with their doctor about they plan to not birth with them. You can do all your prenatals and not inform them that you're going to go and have the baby at another hospital anyway. It's not
Mhm.
nice. It's not great for their bottom line. But in the end, I think that you have to put yourself and your care first. And the thing that's been killing women and killing birthing people, and amongst the myriad of things, right, especially women of color, is this whole like genteel, let's make it comfortable for other people. No,
Mhm.
let's not. Let's not. Let's go into the hospital and tell them, hey, you know what? I don't want an epidural. I don't want you to ask me if I want an epidural. When and if I want an epidural, I will tell you. Please don't say anything about it again. Also, I want intermittent monitoring, you know. I want this, and they're like, we can't tolerate it. Then I don't have to have my baby here, you
Mhm.
know. But people are scared when it comes to having babies.
Yeah. And so how do you address the conversation, Latrice, about the what ifs?
Um, I mean, it has to be had, and it's no tippy-toeing and making flowers out of it. That conversation looks like, okay, I understand. I see your birth plan here. I see all
Mhm.
the things that you want.
Mhm.
And yes, this is all the beautiful side, right? We have to go ahead and address what could happen. And that's how I let them know, listen, um, if there's any like hemorrhaging, if we see that, if you're, if I notice that you are like just really out of breath, the way you're sweating, like is my observations, different things that I see. I want them to know also, okay, not only are we going to call 911, there's a great chance that you're going to be taken to this hospital or this hospital or this hospital. Let's go take a tour. Let's go look at
Mhm.
those hospitals. So I'm
Mhm.
really hands-on in that regard, um,
Okay.
because I just feel like knowing, having that sense of that information, again, that informed piece empowers you, right? And it
Mhm.
gives you a clear understanding that, okay, if he says we're going to UCLA, okay, I've already been to UCLA. I already know what it looks like. This is where we're going, right?
Okay.
During this transfer. So it's conversations like that. And even with the dad, if I feel, and which is why I like to have lots of conversations, because if mom is saying, I'm having a baby at home, and dad is saying, we need to go to the hospital, there's a disconnect there, right?
Mhm.
Um, and so we need to address that. And mom needs to understand, listen, this is his baby too. So if at any point dad is saying, I think we should go, guess what we're going to do? We're
Mhm.
going to go because I can't have you arguing. You guys are going to be fighting after this baby is born because of when and how and whatnot. So you guys need to continue these conversations. A lot of times, families are so focused on the baby shower and the baby's room and
Mhm.
everything
Mhm.
else,
And
all the
not the
good
practical
stuff,
conversations.
not the practical conversations. And I
Mhm.
always put those on the table.
So here's a practical question, ladies. So one of the ways that we know how well we're doing as a nation is because we track data, right? We track outcomes for mom, and we track outcomes for baby. With free births, who's tracking that data?
So I'm gonna say the data doesn't get tracked until that mom takes the baby in to see the pediatrician or goes in after 6 weeks. If that's what the case is, if she's going, to the hospital, that's when things get tracked because then they have that conversation with the OB. And a lot of times, I've had it happen a couple of times only
Hmm.
where
Hmm.
the OB, the original OB said, I can no longer be your OB because that's the choice you made. And I don't want to go behind, what you've done. So, not going to see you. You have to make an appointment with another OB.
And then how does that go down?
They make that appointment with that other OB.
You have
And
to
they are
you have
usually
to
able to
respect.
find someone because oftentimes, especially if it's late, what were you saying, Theresa?
No, they just have to respect. This is after the baby is born, right,
Yeah,
Latrice?
after the baby is born.
I mean, that's because
Yeah,
that could be annoying. You did all the prenatals and you don't
yeah,
get the billing,
yeah,
right? Or
yeah.
I mean, but
Global
you don't have
billing
to.
for us.
Be like, oh, I have a baby. What did you say?
I was saying it's global billing. That's a whole other conversation.
Oh, but it
Theresa.
is. But
Yeah.
it is. You
Yeah, but we should
we got to
we
talk
should
about.
talk about the billing though at some point. Maybe we'll do a separate conversation about that. Just simply because a lot of people believe that that's the motivation with decision making, and perhaps for some clinicians it is, but the way it works, it really doesn't make a huge difference. Like people are saying, oh, they do C-sections because they get paid more money. Not really. So I think even having the conversation on how the payment plan or the payment works out when it comes to C-section versus vaginal versus if you did the prenatal versus if you did the delivery, how that works out for individuals will bring some clarity. But I'll maybe circle back to that and let's talk about how that breakdown works, and also about the billing of doulas, right? Because that comes into conversation, especially in California. I don't know if many people know that there is a controversy because doulas are paid at the same rate for vaginal deliveries as an OB is. And so that is often.
Really? No, but I mean, and that's fine. I mean, what's, like, because we're getting paid like what, insurance or whatever it is, the same rate.
Mm-hmm.
Sorry, OBs. I know it hurts, but welcome to, like, a doula at a birth. I'm with somebody. I've been at a birth with somebody for 72 hours. Just me.
Mhm.
Rubbing, massaging, comforting, not sleeping. And OB is in and out, attending several births. This is not about hierarchy, right? It's about labor. It's about, but
Well, that's one of the argument, but the other argument is the whole incentive of having OBs is that you spend your time getting this education so that you can get a certain reimbursement. Now, if you have piled up like most Black OBs and you don't have pop and mom who has money and you have this huge debt, and then you come out and you could have been a doula, you mean, and get
oh,
paid the same amount?
but you couldn't have been a doula because a doula doesn't have the same level of respect, doesn't have the same level of, just it is
But
there's not the same.
But for some people, that's not as important as your income, right? And so if I didn't have to get all this debt and can get the same income, then you're losing the incentive of having obstetricians.
Right? Having that
And
MD.
so,
But
and so,
that's fine.
and
We
so
need midwives anyway.
it's and so this is the two sides of that conversation. But to the point, now you see why there is pushback, right? Because there are obstetricians that feel a kind of way about.
Yeah, but they've always felt a kind of way, right? Like
But
they always feel a kind of way. Like a free birth is anathema to an OB. Sometimes
oh
a
no, I
midwife
mean about the reimbursement, about the reimbursement. Yeah,
reimbursement. I
yeah.
mean,
But
I, you know,
but touch on that. I was going to ask you, and I think that's where you're heading. Should we be heading in this direction? Is this the right direction in the midst of a maternal health crisis?
I think that obstetrics needs a true overhaul.
Mhm.
An obstetrician is a person that deals with the complications that come up in birth, and their purview of attending the majority of births in the United States, that needs to be re-examined. I think that the majority of births in the United States need to be attended by midwives, right? Midwives, birthing centers, hospitals, if you so choose, home, if you so choose. But, like we should have a whole plethora of midwives, right? That doulas are being paid the same rate or being reimbursed at the same rate. That has to do with your state. That sounds great. I'm moving to California.
You coming to Cali? Come on.
Not coming to Cali. There are various reasons, but I'm not going, I'm not going to tell you. But these children in their school. So,
Mhm.
but yes, I think that I don't know. We're just living in this society where we're always like, if somebody's getting something, I should get it too. Like I should get more. I don't care. Let everybody get paid. Let everybody get paid. Get paid doing
Mm,
what you want to do. Like
mm.
what? Just the whole like.
Or make medical school and the training more affordable,
That's
right?
another thing as well.
That's part of the issue is that you have this humongous debt. And once you hit graduate level education across the board, across industries, across sectors, the availability of grants and supportive program financially are depleted. They're pretty much non-existent. They're like, we expect you to get a higher income. And so you're on your own. You can take out some loans. We'll get you a decent rate. And that's about it. So,
It's you're bringing compassion, humaneness to the whole process of training to be an OB
mhm.
would really make a difference. And it's just not to say that OBs are terrible people. I mean, you're one, and I'm your friend. But the thing is that you walk into rooms and you deal with hostility from as a doula, we deal with hostility from the doctors and hostility from the nurses and a lack of creativity. And don't be in a hospital that has a level 4 NICU. They want to fill those beds. Whereas we might talk about a C-section is not as incentivized, but there was a recent report that talked about how they tend to give Black women an unnecessary C-sections when their surgical their ORs are empty. Like there's a whole, I'll send it to you.
No, that study drew conclusions that it can't because of the type of study that it is. So it's a
Okay.
cross-sectional study. And basically,
Therefore,
people were drawing conclusions that you can't from an observational study.
okay,
So,
that's fair.
whether or not these two things were coexistent doesn't mean that one led to the cause of the other.
Causation
Um,
doesn't.
but to your point, yes, the study, like other studies prior to it, does show a continuous trend of what seems to be a higher rate of unnecessary or lack of indications for C-sections when it comes to Black women, significantly more than any other group. Even there was a study prior to that that looked at the healthy, because one of the criticism or one of the has been, well, the Black woman is less likely to be healthy, and so she's more likely to end up with C-sections, right? But even this one study that looked at healthy Black and Hispanic women, and they showed that even in the quote unquote healthy group, that there was disparities in the C-section rate, which, as we all talked about from prior topics, then lead to the repeat C-sections, right? And the further disparity with that and the whole VBAC calculator. So yeah, there are definitely need for additional conversations and further evaluations to see if there is a financial incentive that leads to the increased risk of C-sections. There were a couple of other sort of theories as to why the disparity occurred, from communication to racial disparities or presumptions and things like that. There's a whole list, but none of these can be concluded just simply because of the type of study that it was. That just, we can't draw conclusions based on those studies, but what we can do is use it as a jump off to do additional studies that where you can get some type of conclusion. But that being said, before we wrap up, I want to get a sense as to if someone was considering free birth, what would you advise them to think about and process?
Me, I would say if you're considering a free birth, I'll say don't fight me, Latrice. I'd say don't get a midwife.
Fight her, Latrice, fight her.
No, don't get a midwife, get a doula, get educated, But getting a free birth doesn't mean that you're irresponsible. It just means that you like to parachute out of planes.
Yes, you are that girl.
You wild like that. Like you are a rebellious spirit.
That was a good way to put it.
And you just, it doesn't mean that.
Wait, that could be another study. Are you a parasailing type woman or are you a parachute type woman? And which one is more indicative of the
whether or not you're going to have a free birth or not.
versus a home birth? So what would you add to that, Latrice? I want you to fight her on that.
You know what? It really is about being that girl, being confident in your body, being educated, understanding all of the ins and outs, and yeah, being accountable for the choice that you made. Theresa made that point of saying that, and yes, and every mom that is that girl, they are ready, they understand, and you know, and that's just it. That's their choice, and they feel really good about it.
Mm-hmm.
Right? They feel really confident. They're ready to go in, 10 toes down, knowing that, hey, I know my body and this is feeling right and I can do it.
The women that I know that have free birth, like that, they're like, I mean, this woman, she waited like she's close to 43 weeks. She didn't think about it, had a lovely time, had a beautiful baby. Everything was really great. And I respect it. I just want to do it. And I wouldn't be like the person to push you to it, right? I'm always the person to be like, here's a little home birth, here's a little home birth, a little midwife.
Now, I will admit that. I will talk about, so I do talk about birthing centers, and I will talk about having a home birth, having a midwife if that's what they're interested in. So all of that.
It's
I didn't get to
discussed.
say all of that. All of that is discussed to just say, you know what, there are other options and there is a backup plan. But when you have that person that is like, I got it.
They
Yeah.
do,
Yeah.
though. They do. Because I know when I was going through my births at the hospital and I said I was going to do what I was going to do, they were like, no, you're not. But then I did,
Mhm.
right? So
Mhm.
I respect it. I just,
Mhm.
I don't have I don't have the blood for it. I don't have but Latrice, she got
Mhm.
you.
She
I
does.
do, I got you.
And me and my obstetrical mind over here, who's thinking about what if she has lupus and it's acute? What if she's an insulin dependent diabetic? What if
So
she?
yes,
You
Taska,
don't want to
that's
do
just
a
it.
fever.
Those are the conversations that are had.
Yeah.
Well,
What are any pre-existing chronic illnesses that you may have? What are
Mhm.
they? Okay, this is what you should know about that.
Yeah.
You
Yeah.
should know that. And so you may want to reconsider. And so that's where those baby steps may come in, where I
Mhm.
will say, what about a birth center? Okay, what about if
Yeah.
the hospital has a birthing wing? You really
Mhm.
just want to have the baby in the water? Okay, why don't you deliver at, UCLA or Cedars where they do have this? Get this reserved for yourself. So I have those conversations. So it's not
Yeah.
like someone says, "Oh, I'm going to have a free birth," and it's like, "Yay, here we go." No,
no.
Mhm.
lots and lots of conversation, education, options, and all those things.
And
Yeah.
I want to
Yeah.
actually point out that Latrice,
Mhm.
not only do you work with people who are that girl, Latrice, you are that girl. You are that girl. Because
What?
And they sense it.
like she is that doula, because she's the one that's gonna be like, like that is a
You
space that
got this.
operate it and it, right? Like in my
Mhm.
world, I am that doula in
Mhm.
the spaces that I operate in, right? The home,
Mhm.
whatever, the knowledge,
Mhm.
gaming the system or whatever. But it would like my greatest joy would be just everybody just having their baby at home or a
Mhm.
home birthing, like a birthing center or
Yeah.
something is like a home away from home
Yeah.
center, right?
Yeah.
That would be so great. And just watching these babies just come out and everybody stay, being intact and,
Mhm.
Nice and calm.
yeah,
These
people
are
Right.
so
approaching.
different than hospital babies.
Yeah.
I
Mhm.
respect people making choices around their bodies, and I also understand that we have to be responsible for our own projections and our own implicit biases and our own beliefs, because people really think that birth is dangerous.
Yeah.
Mhm.
And that is why when somebody talks about a home birth, forget about a free birth, like a home birth, low risk person with a midwife and a doula and surrounded by family and support, people are like, oh, how could you? I've had
Mhm.
clients that ended up not having that and ended up at a hospital and they were very uncomfortable because that was not their nature. But
Right.
yeah, like if there's a way for people to be trained to birth for themselves and to do their screenings, maybe that is an option,
I think that would be a great idea if there's actually some because there are childbirth classes, but perhaps there should be childbirth classes to walk through someone who's considering a free birth option. I mean, as an obstetrician, I see a certain select portion of the population, right? We get the sickest of the sick, right? We get the heart disease, the I can't breathe even walking up the stairs, not related to pregnancy, but even at baseline pre-pregnancy sicker patient. And so our perspective is we see all that end of the spectrum. But ideally, I think everyone wants the same thing. Everyone wants women to have healthy births, to have healthy outcomes, healthy babies. And what I think we need to focus on now is that the experience is also precious to them, that it's not just a process and a procedure, but that birth is actually an experience that is valued. So hopefully we'll get there and hopefully we'll be able to continue having these conversations, devising ways in which we can maximize the safety of everyone to make these options more feasible for a broader portion of the population. So if they want to find out more about Nnenna Birth, and I'm still working on how to say it in Igbo. Is it
Yeah.
Igbo? I'm still trying to figure out how to say it in Igbo. I'm gonna keep working on it. But in the meantime,
Girl, I'm trying to figure out how to say it in Igbo too. So it's fine, girl. It's okay. Nnenna, right?
So
Nnenna.
how can they find you?
Nnenna Birth, www.nnennabirth.com, NNENNABIRTH.com. You can find me, you can email me at Theresa@nnennabirth.com. You can also give me a call at 646-801-4322. And I'm here at your service to give you the information and bring joy and a little inappropriate laughter to everything. Oh, look at that, Just bring some.
We love you for it, Theresa. We do. Latrice, how
need
can
it.
they find you and new baby doula services?
Yes, just email me, newbabydoulaservices@gmail, or you can call me 818-903-4015. Give
We
me a
love
call.
it. Say that in part.
I said, just give a call.
Just give a call. I love it. And when you're done reaching out to them and you want to check us out on Healthy Bump Club, we thank you guys for watching us here on Healthy Bump Club on YouTube and also on Fanbase because we support our own. Okay. And then when you're done there, check us out at healthybump.club on Instagram. We thank you for watching us. Make sure you check out some of our other topics. We did an amazing discussion with Theresa on preparing for your postpartum. That was such a great conversation. Perhaps we'll come back and talk about some of the other things they brought up tonight. We thank you for watching us, and we hope to see you guys when next episode. This is Dr. T. Just a friendly reminder, don't forget to comment, like, and share. And go ahead, why not? Click that subscribe button. Help us to get to the next 1,000 subscribers. We thank you guys for supporting.